Most people assume heart attacks only happen to unhealthy adults, but surprisingly, many seniors who look physically fit still develop dangerous heart problems later in life without obvious warning signs beforehand. Hi, I'm Dr. MD Riyaz. I've been working in emergency and family medicine for the past 7 years, and many families become shocked when healthy looking adults suddenly experience heart emergencies. And honestly, this creates confusion for many people. They exercise regularly, stay physically active, maintain normal cholesterol numbers, yet dangerous processes may still continue developing silently inside arteries. For decades, cholesterol has been treated like the main reason behind heart disease. While cholesterol matters greatly, researchers now understand cardiovascular disease usually involves deeper biological processes too. One major factor doctors discuss more today is chronic inflammation inside blood vessels. This inflammation may quietly damage artery linings long before symptoms become obvious externally later in life. And surprisingly, inflammation often develops silently. Many adults continue feeling physically normal, while irritation and plaque buildup gradually continue forming inside arteries throughout years without being noticed internally beforehand later afterward. The inner lining of blood vessels is actually delicate and sensitive. When repeatedly irritated, the body responds almost like repairing a small injury happening internally inside artery walls over time afterward naturally. And this is where things slowly become more complicated internally. Cholesterol particles, inflammatory cells, calcium, and other substances begin collecting around damaged areas inside arteries gradually afterward over many years. Over time, this collection forms plaque inside blood vessels. And surprisingly, plaque buildup usually develops silently, which explains why many adults remain unaware until emergencies suddenly appear later internally afterward overall. That's one reason some seniors experience heart attacks without dramatic warning signs beforehand. The dangerous process often existed quietly already, long before the emergency suddenly occurred afterward. Many adults believe normal cholesterol automatically means healthy arteries overall. Unfortunately, cardiovascular risk is often much more complicated than one standard cholesterol number shown during blood testing. Traditional cholesterol tests usually measure LDL broadly, but some specialists believe those tests may not fully explain harmful particles moving repeatedly through blood vessels daily. That's why newer markers receive increasing attention today. Many preventive specialists now focus more carefully on inflammation, particle numbers, and long-term vascular health. One important marker doctors discuss today is high-sensitivity CRP, commonly called hs-CRP. This test helps measure inflammation levels occurring throughout the body. Higher hs-CRP levels may suggest inflammatory activity affecting blood vessels, even when traditional cholesterol numbers still appear relatively normal during routine blood testing. Another important marker receiving attention today is ApoB, short for apolipoprotein B. This marker estimates harmful cholesterol particle numbers moving through circulation repeatedly. Some researchers now believe ApoB predicts cardiovascular risk more accurately for certain adults, compared with relying only on traditional LDL cholesterol measurements. Because artery damage depends on several factors working together. Cholesterol amount, inflammation, blood pressure, smoking, blood sugar, and vascular stress all influence heart health. And this explains why appearance alone sometimes becomes misleading. Someone may look slim, energetic, and physically active, while hidden damage quietly continues progressing. Many adults assume heart disease mainly affects overweight people only, but inflammation and arterial damage may develop across different body types and lifestyles. Chronic stress itself may strongly affect cardiovascular health over time. Stress hormones influence inflammation, circulation, blood pressure, and blood vessel function throughout daily life. Poor sleep matters too, much more than many adults initially realize. Repeated sleep disruption may worsen inflammation, recovery, blood pressure, and overall cardiovascular function. Modern lifestyles also combine several risks together simultaneously. Sitting longer, moving less, eating processed foods, and sleeping poorly may all affect artery health. The difficult part is these habits rarely create immediate symptoms. Damage develops quietly, gradually, and invisibly, which makes many adults believe everything feels normal. Even regular exercise alone may not fully eliminate cardiovascular risk. Someone may walk daily, remain active, and still experience inflammation affecting arteries silently. That's why preventive heart health involves much more than simply looking healthy externally. The real goal is understanding what's happening deeper inside blood vessels. And honestly, many adults watching probably never heard heart disease explained this way before. I genuinely like hearing whether anyone discussed inflammation testing before. Food quality matters significantly here too. Highly processed foods, excess sugar, and repeated blood sugar spikes may contribute toward inflammation affecting blood vessels. Smoking remains another major source of vascular inflammation today. Even adults appearing physically healthy may continuously damage artery linings through repeated smoking habits. High blood pressure contributes to cone because constant pressure against artery walls may slowly damage delicate blood vessel linings over many years. After 50, these factors become increasingly important for many adults. Blood vessels naturally lose flexibility with age, making recovery from stress more difficult. This doesn't mean heart disease becomes unavoidable later in life. But prevention usually requires deeper awareness than many adults were taught previously. A lot of adults still believe passing routine cholesterol tests guarantees cardiovascular safety. Unfortunately, artery health involves far more complex biological processes than most realize. And honestly, this misunderstanding sometimes delays important conversations with doctors. Many adults ignore early warning signs because they assume normal cholesterol means healthy arteries. Some warning signs may include unusual fatigue, chest pressure during activity, slower recovery, or reduced exercise tolerance compared with earlier years. But sometimes, there are no obvious symptoms at all initially. That's why many specialists emphasize prevention, regular checkups, and discussing cardiovascular risk carefully. Importantly, no blood test predicts the future perfectly for every individual. Tests simply provide additional information helping doctors understand cardiovascular risk more accurately. And this video isn't suggesting advanced testing becomes necessary for everyone immediately. But adults with family history, diabetes, smoking, or high blood pressure may benefit discussing these markers carefully. What surprises many cardiologists today is how often heart disease develop alongside metabolic problems. Blood sugar spikes, insulin resistance, and abdominal fat may quietly worsen vascular inflammation. Visceral fat behaves differently from ordinary body fat. It releases inflammatory chemicals continuously, which may affect blood vessels, insulin sensitivity, and long-term cardiovascular health over time. And this becomes increasingly important after 50. Hormonal changes, lower muscle mass, and slower metabolism may all make inflammatory processes more difficult for the body to control. Another factor many adults never consider is oral health. Researchers now study possible connections between chronic gum inflammation and increased cardiovascular disease risk later in life. Bacteria from unhealthy gums may sometimes enter circulation repeatedly. Over years, this may contribute toward inflammatory stress, affecting blood vessels and overall cardiovascular function. That's why many specialists now encourage regular dental care as part of long-term heart health, especially for older adults already managing diabetes or blood pressure problems. Air pollution may also affect cardiovascular systems more than people realize. Tiny particles from traffic or smoke may increase oxidative stress and inflammation inside blood vessels gradually. And interestingly, loneliness itself may influence cardiovascular health too. Chronic social isolation has been associated with higher stress hormones, poorer sleep, and worse recovery patterns overall. Most adults focus only on obvious risks like cholesterol or weight. But cardiovascular health usually reflects many systems interacting together continuously throughout normal daily life. That's why prevention becomes more powerful when habits work together. Better sleep, movement, nutrition, stress reduction, and social connection may all support healthier vascular function simultaneously. One simple habit many cardiologists recommend is walking after meals. Even short walks may help blood sugar regulation, circulation, and post-meal inflammation responses throughout the body. Strength training becomes important too, especially after 50. Maintaining muscle mass may improve insulin sensitivity, metabolic health, balance, and overall cardiovascular resilience over time. And honestly, I'm curious what people here still want explained about heart health after 50. Comment topics you'd like covered next, because others probably share similar concerns too. And the body responds differently when movement disappears completely. Long sitting periods may reduce circulation efficiency, stiffen blood vessels, and worsen metabolic function gradually during aging. Food timing may matter more than many adults realize too. Large late-night meals sometimes affect blood pressure, blood sugar, sleep quality, and overnight recovery processes simultaneously. Some specialists now encourage earlier dinners for certain adults. Giving the body longer overnight recovery time may help metabolic health and improve cardiovascular recovery patterns overall. Sleep quality matters deeply here as well. During healthy sleep, blood pressure naturally lowers, inflammation decreases, and blood vessels enter important repair and recovery phases. But chronic sleep deprivation changes those patterns completely. Poor sleep may increase stress hormones, worsen insulin resistance, and elevate inflammatory activity repeatedly throughout the cardiovascular system. Another overlooked issue is untreated sleep apnea. Many adults snore for years without realizing nighttime oxygen drops may place serious stress on the heart repeatedly. That's why unexplained fatigue, morning headaches, loud snoring, or waking unrefreshed sometimes deserve proper medical attention, especially alongside high blood pressure or weight gain. And honestly, many adults underestimate how strongly smoking damages blood vessels over time. Even occasional smoking may increase inflammation, reduce artery flexibility, and place continuous stress on the heart. Real heart protection usually comes from consistent daily habits, not chasing perfect cholesterol numbers alone. And if you want another heart topic explained next, comment your biggest question below.